Hello everybody and welcome to the Thursday edition of Video Clips, and I want to talk about cancer today. I've been dealing with this a lot in my personal life. Members of the Wellness Forum who have cancer, personal friends who have cancer. It's been on my radar screen, so I do want to talk about it. So I want to talk about metastatic breast cancer first. The outcomes for patients with metastatic breast cancer are dismal. They haven't really changed much during the last several decades. And the tendency is to administer aggressive treatment, which often includes chemotherapy, surgery, radiation, and other drugs. And if one thing isn't working, I guess the mentality is if we just do more and more of it, then maybe it'll work. It doesn't, but new study shows that surgery and radiation don't improve survival in these types of patients enough to justify their use. So the researchers conducted a randomized controlled trial that included 350 women between 2005 and 2013. The patients had metastatic breast cancer and had responded positively to 6 cycles of chemotherapy, after which they were randomized into 2 groups. So 173 of the women underwent localized surgery and radiation. 177 of them did not. The groups were matched for things like age and tumor size and hormone receptor status and degree of metastases. Women in the surgery group had partial or complete removal of their breasts and axillary lymph nodes, followed by radiation therapy. The other women did not engage in those activities. During the follow-up time, which was an average of 17 months, 218 women in the group died, or 62%. 111 from the surgery group and 107 from the group that didn't have surgery. There was no statistical significance in the median survival time. In fact, the women who didn't have surgery and radiation were slightly better off in terms of survival time than the women who did have the surgery and radiation, but it didn't reach statistical significance. And really, this is, when you look at the low survival rate in both groups, it really should motivate women to take excellent care of themselves and not get cancer. This stuff just doesn't save your life. The authors stated that some animal studies and a review of human patient records shows a relationship between surgical removal of tumors, not just of the breast, but tumors in general, and the growth of secondary cancers in other parts of the body. Researchers are not clear on the cause of this relationship, but there are a couple of hypotheses. One is that during recovery from surgery, growth factors that are produced for healing activate the growth of new tumors. Another is that the primary tumor, when left alone, sends out signals that inhibit the growth of metastasized cancer cells, and that this protective effect ends when the primary tumor is removed. The authors concluded that local surgery and radiation have no effect on patients with metastasized breast cancer who respond to chemotherapy, and they could not identify any subgroup of patients who would benefit. The study results were presented at the San Antonio Breast Cancer Symposium in December 2013. Overtreatment of cancer patients is significant. It's a big issue, and I want to transition to another topic that really is more of the same thing. And I'll just start by saying that discussing treatment options with cancer patients is often really difficult for a lot of reasons. You know, trying to talk somebody out of surgery and radiation who's been told they should do it is not easy. Patients are panicked and frightened about their health. They're pressured by doctors and well-meaning friends and family to immediately undergo treatment. And last but not least, they're misled by false promises from the person, from their oncologist. And I often find myself as being the lone voice talking about, why don't we take a look at this in scientific terms and see what these treatments really have to offer. Now, I've been relying on Ralph Moss for years because he does present accurate data on treatment options, and he's been a valuable backup for me over the years. So in a recent article that he authored, Dr. Moss countered the American Cancer Society and healthcare professionals' enthusiasm for new developments in the treatment of metastatic colon cancer, colorectal cancer. And I always am fascinated to see the difference in what the headlines show. It's a big breakthrough and all this sort of thing, versus when you read the studies and see what they show. There's such a disconnect. It's just amazing to me. 4 new treatments are being touted as representing great progress in treatment for metastatic colorectal cancer, but according to Dr. Moss, when you compare the claims with the actual results, actually not so great. Now, part of the problem is that outcomes are so dismal for these patients, they live a year or 2, that drug companies and doctors keep adding additional drugs. If one drug doesn't do it, let's add some more. There are combination therapies, hoping that the combinations will do better than the original treatment. So, for example, the Piccolo trial compared patients using a standard colorectal cancer therapy with one taken in combination with a new drug called Vectibix. The combined treatment group experienced more side effects, and 5 patients died from the treatment. No increase in overall survival between the groups. This drug is approved by the FDA for use, by the way, and the cost is $4,000 every 2 weeks, about $100,000 a year for not a single extra day of survival. Avastin added to traditional treatment extended life by 1.4 months, from 19.9 months to 21.3 months, not even reaching statistical significance. In one trial, Zaltrap was tested in combination with a traditional therapy. The combination therapy added 6 weeks to survival. The cost, $132,000 a year. Still another trial showed that Stivarga added 1 week of progression-free survival and 1.4 months of overall survival with a response rate of only 1.6%. All these drugs are approved for this use. Bayer is the maker of Stivarga. They're projecting sales of over $1 billion this year for a drug that is essentially useless. Survival outcomes, again, are terrible for people with colorectal cancer, which should serve as a deterrent for eating the standard American diet, which is the cause of most colorectal cancer. Now, patients with unlimited funds provided by their insurance companies can expect to live for a year or two. Those willing to take additional and newer drugs, which are even more expensive and cause even more side effects, can expect to get another month to a month and a half of life. Yet doctors, researchers, drug companies, the American Cancer Society celebrate the great progress that these treatments represent and heartily recommend them to their patients. I wish I could say that it was just colorectal cancer drugs, but obviously not. I just covered the enthusiasm for surgery and radiation that are useless for metastasized breast cancer patients. But all this comes down to this is the point I want to make from all this. Cancer patients have various serious decisions to make, and they need to take a deep breath and evaluate evidence before they make their decisions. You know, the worst situation I find in my office is when people come in and say, well, my gosh, if I'd known all this stuff, then I wouldn't have done any of these things. Well, find out now before you engage in these things that really don't help very much. All right, that's all for now and all for this week. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you again next Tuesday.